every ear pain is not an ear infection. Hello, my name is Dr. Shikha Bani. I am working as ENT consultant and head and neck surgeon in Apollo Noida Hospital. So today we'll be talking about the most common emergency which people land up with is the acute ear pain. So there are very many causes of the ear pain and which are particularly localized with the ear only. It could be an external ear infection, middle ear, or the internal ear infection. And sometimes there could be a referred otalgia. That means the pain is somewhere in the head and neck area and which patient is feeling inside the ear. So commonly the patient comes to us if there is a pain in the ear. They generally tend to instill something or the else in the ear, as very well known is the mustard oil, which is totally obsolete these days. So we should not put mustard oil without consulting any ENT doctor. So foremost is what thing you can do at home if at night or at any emergency thing it happens ear pain. So what thing you can do? A hot fomentation over the ear, over your concerned ear. You can do a hot water fomentation over the ear. Secondly, you can take any analgesic like a crocin or a paracetamol is a very safe and I will recommend not to put anything in the ear before consulting a ENT doctor. For the external ear, there could be an external skin infection in the ear that is known as the Otitis externa, and the middle ear infections. So all the infections in the external ear, the middle, they have different symptoms. Like for the external ear, generally we have the pain in the ear. Sometimes we feel blockage in the ear. Sometimes there is a discharge, and the type of the discharge which comes out from the ear itself suggests which type of the infection is this. Sometimes it is a watery discharge, that it could be a sinus related problem to the ear. Sometimes there is a upper respiratory tract infection and the patient, it get transmitted to the ear and we get a instant acute pain in the ear, then a blood tinged or a watery discharge comes out the ear. And when there is a bacterial infection supervene over it, we get a yellowish color of a discharge in it. So type of the infection and the type of the discharge will generally depict the type of the infection which a patient gets. So it is well recommended not to put anything in the ear without consulting a doctor. Recently, just 4 to 5 days back, I got a patient. He instilled a crushed flowers of sunflower crushed into the ear, and there was a lot of fungal infection in the ear. The patient presented with very much of the, so I will recommend you not to put anything, just do a hot fomentation over the ear, or more of you can take a crocin or any painkiller which is available and just reach to your doctor.